That's my flesh crawl. Yes. I think our co-conspirator Ed may still be there.
No, he's not a board member.
Oh, did he shit can them too?
I don't have any clue, but he's not a board member.
Okay. Little joking there. Okay.
Am I supposed to be able to see you?
You hear?
Can't you just look at the window?
Oh, nice.
In there.
It smells.
The closet door was a discoloration. The tape was.
Okay, so how many folks we have on our Zoom meeting right now? How are we doing?
28.
28.
Down at the bottom of your screen, it gives the number.
Okay, and for those who are in on the Zoom call, you'll see there's a chat box, might be up on the top or down, depending whether you're on a computer or a tablet.
Right.
And I think there's some messages in the chat, so feel free to join the chat and introduce yourselves. And we'll be getting started with the town hall in just a couple of minutes. Susan Weber is going to get us started. I'll be speaking. We have a couple of other speakers, and then we'll be having a conversation with your questions, with your comments, and I'm really looking forward to that. So we'll be getting started in a couple of minutes. We're giving people just a couple more minutes to arrive, especially people who tend to be fashionably late. I guess we don't have too many people getting stuck in traffic or having trouble parking their cars. So you should be able to get started soon. You know, when we used to have in-person meetings, and we'll have them again soon, we hope, these are the things we have to keep in mind. But I guess there's some different issues nowadays.
Different issues is right. Okay.
All righty.
You know, we still have 28 people. I think maybe we should start. What do you think?
Okay with me.
Okay with everybody? All right.
Yeah, it's overdue.
Doug,
Okay.
I'm going to mute you. What are you still? Okay. So, as you know, tonight we will be addressing the novel coronavirus and the major flaws in our healthcare system that this pandemic has revealed. We hope to bring some information to you about the COVID-19 disease, the situation here in upstate New York, and how we can come out of this crisis better and stronger than before. Joe Seaman, the Democratic and Working Families Party candidate for the New York State Assembly in the 112th District, will speak first. And we have with us Dr. George Jolie of Physicians for a National Health Program and nurse Lisa Blodgett. Thank you, Lisa, for stepping in at the last moment here in a moment of crisis from the New York State Nurses Association, who will also speak. Then we will take questions, first from our Zoom participants, and then if we have time, for others via the chat function and on Facebook. And we'd like to take questions from residents of the district first. So if you wish to ask a question when the question time commences, please raise your hand on Zoom. You click on the participant icon at the bottom or somewhere on your screen, you'll see a participant icon, and then click on raise your hand, and then we'll be able to see it. Okay, all right, let's start. So here is my very good friend and longtime fellow organizer, and now Yippee candidate for the Assembly, Joe Seaman.
Thanks. Thanks, Susan, for the introduction. Thanks, everyone, for joining us here today. And this is a very serious subject we're going to be talking about.
It's in
And
progress.
so while there was nothing we could have done to stop COVID-19 entirely, we could have done a lot to better prepare for it. And the lessons that we learn now can help us prepare for future pandemics. So I'd like to talk about long-term solutions that New York needs to enact, as well as what we need to do in this immediate crisis. So before this pandemic, there were many people who were uninsured and underinsured. And there were people who couldn't get to a doctor when they were sick, and there were people who died because of their lack of health care. And now we've got tens of thousands of people dying in this pandemic. And we know that in addition to the elderly, the people who are more likely to die from COVID-19 are people with underlying health problems. And this includes people who have problems that would have been addressed if they had good health care, good health insurance. And unfortunately, people who lacked that health care are amongst the people who are dying now. So before this pandemic, there were people who had bankrupt and suffered economically due to excessive uncovered medical costs. And now there are millions of people losing their jobs, and with that, they're losing their employer-based health insurance. So this also will harm people's health and create more bankruptcies and more poverty. And these are some of the problems we face. And let's ask, what can we do about this? Well, we can make healthcare for all New Yorkers a reality. A healthcare that's not based on employment status, not based on financial status, but it's a basic human right, just like it is in most of the developed world. And the question often becomes, how can we afford this? How can we pay for it? Well, we can afford healthcare for all New Yorkers if we can cut out the excessive profits of insurance companies. Whether our families get the healthcare we need shouldn't be determined by insurance company profits. The New York Health Act is a bill that would create a healthcare system for all New Yorkers and would save money for 98% of us. And we'll be talking more about that. And that's something that I plan to work on passing in the New York Assembly. Now, another issue is the problems of hospitals and healthcare's funding. And we're seeing hospitals and health centers losing much of their income stream because non-emergency procedures have been canceled during this crisis. So we're calling on the federal government to provide funding, and also New York State has to step up and see that our hospitals and our health centers are sufficiently funded now and past this crisis. And again, New York can afford this. We can afford this if we simply make the ultra wealthy pay their fair share. The New York Budget Justice Coalition has presented 14 bills that would close these massive corporate loopholes for the ultra wealthy, and would raise tens of billions of dollars. So the money exists to fund our hospitals, to fund our health centers, and all we need is the political will to do so. And we'll talk more about how we can do that. And now we see frontline healthcare workers being hailed as heroes, as they should be. But we can do more than recognize them with words. We can make sure that they're treated right. The health of our communities depends on having nurses and other healthcare workers who can do their jobs without having to fight for their own health and their own safety. As part of funding hospitals and healthcare providers, we can make sure that nurses and other healthcare workers are given working conditions that best allow them to give patients the care they need. And that means safe staffing levels. If there are too few nurses, too few doctors, and too many patients, both the caregivers and the patients suffer. And another thing we need to do, we need to make sure that the healthcare workers and community groups also have a seat at the table when the decisions are made, decisions about when hospitals and health centers are opened, closed, expanded. And this is also something we can talk more about. We can pass legislation to make sure that the healthcare workers and our community groups have a seat at the table and have a real voice into what's being done. So in addition to addressing these long-term systemic healthcare issues, New York has to do everything we can right now to flatten the curve and to prevent more deaths from COVID-19. So we must stand united as a state. We must see that protective equipment, ventilators, other necessary resources are moved to where they're needed. And I want to particularly applaud the Capital Region healthcare workers who've offered to deploy downstate where this need has been urgent. Now, it's very important that we are particularly careful to avoid a second wave of infections. And that can happen if we open things up too quickly. Governor Cuomo has outlined objective scientific criteria that we need to meet. We've got to have widespread comprehensive testing statewide. We have to have contact tracers who can identify how the virus is being spread, isolate those who are infected, and stop the spread. We have to be sure that the COVID-19 caseload is declining and that hospitals have the space they need for more patients. So we mustn't lift these safety restrictions until we've met these scientific standards and we're confident that we're all safe. Decisions to resume to normal activities have to be made based upon science, not on the clamoring of aggressive extremists organized by corporate front groups and anti-science politicians. So as a candidate for New York Assembly, these are some of my primary concerns about healthcare and COVID-19. And we'll be hearing from a couple of other speakers, and then we'll get to your concerns, to your questions, and we'll continue this conversation. So right now, we'll be hearing from Dr. George Jolly of Physicians for a National Health Plan, and also from the Saratoga Health Committee. So George, thanks for joining us, and please tell us what you think we need to be concerned about today. And George, you're on mute. You've got to unmute yourself first. George,
Sure.
You've got to unmute yourself. We can't hear you. Thank you. Okay, sorry to go.
I think, can you hear me now? I don't.
Bit louder.
Let's see, I'll turn up my my microphone a little bit as well then. How's that? Can you hear me?
Speak up, yes.
I can make it even.
Great. But we've got myself as the main image here. Susan, if you could put George over as the main image, as the main speaker. Please.
Okay, sorry.
Okay.
Huh?
How, there I am.
Oh,
Shock.
What?
Welcome, everybody. Joe, I appreciate the opportunity to be here, and I'm delighted that you're willing to do this and bring people, local, us together, our community together to talk about some of these issues.
let him in. If he causes trouble, we'll get rid of him.
Susan, I think we're hearing you when you should
Oh.
be muted. That's all right. All right, we're all.
I'm
folks,
sorry,
we're all
those
learning
little
how to do this.
glitches, they're all my fault.
It's all right. We're all learning. Thanks everybody for patience. This is not a perfect process. We're all learning how to do these virtual town halls. Go ahead, George.
I want you all to think about COVID-19 as a stress test. The epidemic has been a stress test for the whole country. It's been a test for the American medical community, for our economy, for our social safety nets, and for our leadership. The stress test of an individual or an institution asks for demonstration of increased strength and flexibility beyond what's required under normal circumstances. Because under stress, we can see where our weaknesses lie. In this regard, we need to view the epidemic as an opportunity for improvement. The first thing, health insurance tied to employment is a disaster. With the economic meltdown, millions are losing their health insurance. By this summer, there may be 50 million people in the country uninsured. And even if current coverage is maintained, much of it is inadequate, requiring unreasonable, unmanageable out-of-pocket expense. Family financial reserves, which have already been scanty in this country, are going to continue to be even more inadequate. Containing the virus requires identification and isolation of those who are infected. Our system does not make that easy. We've made it difficult for large segments of working America to participate in the healthcare system. Many of the working poor are either not offered health insurance or faced with unmanageable costs of high deductible plans. Distrust of government is very common, often for good reason. The undocumented are outright excluded. Even legal immigrants are denied use of safety nets. The consequence of this in this epidemic is clear. People know they have to work in order to feed their families. When workers are sick, staying home is just not an option. And even seeking medical care is cost prohibitive and outright dangerous. Our public health infrastructure has been woefully neglected. We could have anticipated such an epidemic might occur and spread worldwide the way this did. Preparation would have required stockpiling of sufficient protective gear, decisions about whether to invest in the development or stockpiling of equipment cannot be left to market forces dependent on profit making. Excessive efficiency also eliminates systemic flexibility. That is, if we try to cut profit margins too closely, then we eliminate the flexibility that we need to get through a crisis like the present. The public's understanding of public health issues is very poor, both in terms of biology and in terms of the system. This is a public education problem. The importance of national leadership is so clear. Leaders must present a consistent, unified plan of response based on science and not encumbered by politics. The coronavirus test is not going to destroy our country, in spite of the many deaths and the economic collapse. As a society, we are going to recover. But the test will show us our weaknesses, and I hope we'll be able to learn and emerge wiser, stronger, and better prepared for the next crisis. Thanks.
Okay, thanks. That was Dr. George Jolly. And we're next going to hear from Lisa Blodgett of the New York State Nurses Association. So Lisa, thanks for joining us. And please go ahead. Susan, I guess you can put Lisa on and hopefully that'll work. Okay.
Well, I'd like to say thank you. Unfortunately, Kathy Dawson, one of our OR nurses here at Ellis Hospital, had a emergency case come in, and so couldn't be here. So I'm the fill-in. Not sure what the echo is.
What is that noise?
Lisa, is that maybe your, do you have a phone on as well?
I do have, I'm at Ellis, so I'm not sure.
Strange, it just
Apologize, I'm
started.
not sure what it is. I'll shut off my main phone.
Let me see.
Yeah, it's my computer for some reason, I'm not sure. How's that? Is that better? Can
I
you hear
think the
me?
problem's gone.
Okay, now can you hear me?
Yes. Oh,
There it is.
it was
Um,
back.
Okay, my
So now-
apologies. Gotta be something with, oh, there it is again. Okay,
Now,
okay, I'm gonna speak quickly. This COVID crisis, as a nurse of over 29 years, I am so thankful that staffing ratios were mentioned. In this time, it is so important to have the proper amount of nurses to take care of these patients. My specialty is emergency room. I do work for New York State Nurses Association representing Ellis in Bellevue, VNS, and Latour. I've spent pretty much every day. I'm currently at Ellis right now. And I can tell you that this healthcare issue, related to COVID-19, some of what we're seeing is folks who are underinsured, who don't have the ability to have the proper health care. Our African American community have been highly affected. Finally, I'm kind of jumping around a little bit, but finally testing is getting out there in the community, which I think will help. But we have to have the proper resources. And unfortunately, pandemic, we're seeing what folks are affected. The healthcare, the nurses are seeing who are affected. I can tell you that of the patient load that we've seen COVID-wise, unfortunately, it's a lot of folks who are underinsured, who have a ton of comorbidities. And then surprisingly, a lot of patients who have had no comorbidities, but again, are affected because they don't have perhaps adequate health insurance and aren't being followed by a provider. And so hence, maybe they do have some underlying comorbidities that we don't know of. Majority of the patients who that have been affected to the point where they've had to be ventilated, they're not just elderly. We've seen a lot of, unfortunately, patients who are in their mid, 40s to late 40s. So again, the resources, they need to be, we need to have proper staffing. We need to have single payer or New York Health so that every individual has proper health insurance. So important. I mean, this pandemic, we're seeing so many different issues that should have never have been. I want to go back to the nursing staff. Again, the PPE, horrible, what I've seen, the reuse of PPE, as we speak, still having nurses reuse PPE, which is face masks. You're, fitted N95s. This is not an N95, this is a KN95. But to repurpose those, I'm kind of jumping around a little bit, but I mean, I don't think we have enough time for me personally to even address what, really needs to be tackled. And thank God there are folks as like Joe who are willing to address these issues and really tackle these issues. But as frontline workers, every night I go home and I'm just kind of overwhelmed with what the nurses have to deal with and the healthcare system, the lack of, I just don't even know what to say. Again, thank you for the opportunity. I really hope that we can address a lot of these issues. Again, the proper supplies, ratios. I do want to mention one thing. As far as nurses, we have some facilities. I don't know if all you folks realize this, but some facilities are wanting to furlough and lay off nurses. Can you believe that during this
No.
time? St. Elizabeth's in central New York, Nathan Latour decided in their infamous wisdom that they wanted to furlough and mandate low census during this pandemic time. Ridiculous. As Dr. Jolly had mentioned, we don't know. There's so many unknowns. This is not the time to do this. We need all folks, all nurses, all frontline workers, hands-on. And in the city, they still need a lot of assistance. Here, we've seen a decline, thank God. But again, I do want to, I want to mention that testing has been taking place in our in the areas where there isn't really great healthcare. Their mobile testing has been happening at Mount Pleasant Middle School, and it's for those folks that are underinsured, our African American community. So far, there's been about 169 mobile tests that have been done. And that we need to get these resources out to these folks, these underinsured communities, which will in turn help the hospitals. If we can identify, who is positive and get them the proper health insurance and treatment before, another exposure occurs and another exposure occurs. Again, I won't take up any more time. And thank you very much for the opportunity to speak.
Thank you very much. That was most interesting and pretty scary. And you both confirmed what seems to be in the air right now. And do you think, Lisa, that the public perception now is changing and turning away from ignoring healthcare for all back to considering the necessity for it?
I think with this economic situation that is starting to unravel, and with folks being out of work, and as Dr. Jolie had stated, now you're going to have a lot of folks who aren't going to have health insurance. And as this pandemic has not come to an end, and we don't know when it will, I am hopeful that the public will be very receptive to single payer to New York Health. Definitely, they have to be. There has to be something done. Because we have got to get folks insured, get them the ability to, have continued health care, have access to providers, rather than wait till somebody's in a crisis, be proactive and get them the medical attention that they need. Make sure that they're getting their medications for hypertension, if they're diabetics and they don't know that they're diabetics, make sure that they're getting, all the lab work and again, the care. As we know, this COVID-19 does attack folks who are most vulnerable. It's actually all over the spectrum. It's really, it's very, I myself, I kind of creeps me out because of course, our political leaders are saying, oh, it's only the elderly, or it's the, people who, who fall into these, very specific medical, diagnoses, or however I'm trying to say it. It's not.
Yeah.
It's not.
No.
There's no rhyme or reason. And again, some folks, I know specifically, I don't want to violate HIPAA or anything, but I've known somebody who had no comorbidities, again, in their early 40s, who ended up vented. I mean, what?
This almost random occurrence of bad outcomes that Lisa's commenting about, even in middle-aged folks, is absolutely one of the scary things about COVID-19. And it really underlies the fact that the scientific evaluation is absolute.
I'll try to stop them and ask if people have questions. What?
Go ahead. I think Susan, you were unmuted and we were trying to hear George. So Susan, you might want to mute yourself. I'm going to mute myself here again.
I'm going to keep myself unmuted for one moment and ask people if they have questions, please raise your hand. You go down to the participant box and click on your name like that, and I don't know. Raise your hand. There should be a way to raise your hand there.
I'd just like to add that if you can't figure out how to raise your hand, if you go into the chat and state into the chat that you'd like to be called on to ask a question, maybe we'll work that. Again, thanks everyone for putting up with the technical difficulties. I just had a technical difficulty where my device just booted itself in the middle of this. So I lost a little bit. Thanks everyone for your patience. And so we'll go back to Susan, and we'll be taking your comments, your questions, and your concerns. I just want to mention that today is National Nurses Day. So it's a day when we thank Lisa Blodgett, and we thank all the nurses for all they've been doing in this crisis and all they've been doing all the time. And we hope we're going to have policies in New York that just don't just recognize them with words, but recognize them with actions. So we'll be taking your questions. I'm Joe Seaman. I'm a candidate for New York State Assembly in the 112th District, representing a number of towns in Saratoga and Schenectady County. We've invited my opponent, the incumbent, and she declined to respond, but we'd like to hear the viewpoints and the concerns of people of all different political backgrounds, different beliefs. So we'll be taking your questions and your comments.
Now I know that Josh Mitchell had a question. Josh, whoops.
I'm sorry, I'm here. I literally right before you said my name, I started to choke on the water I was drinking. So
Take your time. Take your time.
Let me mute myself.
We can all
for
have
just
a
1
drink
second.
of water while we're waiting for your voice to clear.
Okay. Again, thanks everyone for your patience. We're learning how to use this technology.
I think that I have a lot more to learn because I've got a phone here. Some other people are talking to me on, and at the same time, and then I'm supposed to be listening to them, but I'm also trying to do this. So I'm not as risky as I used to be, you know. Josh, where are you? Are you back?
I'm here. I'm here.
Would you like to ask?
I do. So I wanted to talk about, it's a question and a statement combined. I wanted to talk about the intersection of this healthcare crisis right now, the pandemic, and criminal justice, and that one of those intersections is the state of law with cannabis. And it's absolutely applicable for the pandemic, because being incarcerated or just being arrested and being in the jail cell is a very confined, very unsanitary environment, disproportionately affecting minorities, people of color, African Americans, Latinos. So Joe has already stated his support for legalizing, but I wanted to bring that up as a topic of discussion because there are currently, despite the fact that we have a medical marijuana program, and despite the fact that we have decriminalized marijuana, we are currently still incarcerating folks for marijuana. And so the same folks that are already vulnerable, the uninsured people of color, are also being arrested when the arrest is supposed to be going down. So that is my topic right now.
So I'd like to respond to that, and other folks feel free to speak up. So there are a lot of problems that intersect, and we know that there's a problem in New York and across America of mass incarceration. And when we have over 2 million people in jail in America, that's a problem. Obviously, the jails are a place where this virus is spreading incredibly, and there's a huge percentage of the prison population and also the people who work there, the staff at prisons, who are also significantly infected with COVID-19. So we obviously need to see that people who don't need to be in jail are let out just for their safety in this instance. And we've seen a lot of that happening in New York. But we've got a larger problem of mass incarceration, and I'd like to support, when I'm in the assembly, policies that will reduce mass incarceration. One of those things is legalizing, taxing, and regulating cannabis, as we see in states like Massachusetts and Vermont, and we see in Canada. We also have issues of bail reform. My opponent was one of those who wanted to repeal bail reform. I've supported bail reform as a matter of people who shouldn't be kept in jail just for the crime of being poor. So there's a lot we can do to decrease mass incarceration. We can take our drug problems, another big health issue, the issues of substance abuse, and we can treat it as more of a health problem rather than a criminal problem. So thanks, Josh, for bringing that up. And it's one of the many issues of justice, of fairness, that intersect with our problems of lack of health care and the problems of people suffering from this virus. So that's something that I'd like to work on when I'm in the assembly. And thank you for giving us that point.
Okay, we have a question from Donald Weichenhund. And I can't, Donald, are you?
Yeah, I'm here. Can you hear me?
Oh, good. Great.
Yeah.
Welcome,
Yes.
Donald.
Hey, Joe. So listen, first of all, again, just thank you so much for running. This is such a very important thing to do. So recently, our family has been very concerned by Governor Cuomo's engagement with Bill Gates around education. So in the past, Bill Gates and the Gates Foundation has been very problematic with respect to supporting public education. And I just wanted to hear from you what your thoughts were on that and how you in the assembly would support public education.
Sure. Well, for those of you who don't know, I'll give you a little my background. I retired not too long ago after a 30+ year career at the New York State Education Department. And while I was an information technology worker there, I dealt with a number of the people working on the policies. One of the big issues that we're concerned about is charter schools. And we know the Gates Foundation has supported charter schools. And what we found is that charter schools don't produce better outcomes for the students. What charter schools are very effective at is at busting teachers' unions. That's the big problem of charter schools. The teachers there are not unionized like public school teachers, and that's what I believe is why my opponent and her political party has been very strong proponents of charter schools, and I'm not. So I'd like to see that we have all our schools are unionized, that all meet the same set of standards. And unfortunately, that's not the case for charter schools. And another issue that we've seen from the Gates Foundation is about standardized testing. And we've seen a problem in New York of teachers teaching to the test. And that's something that I think we need to work on. We need to reduce the emphasis on the standardized tests. I understand they have their role, and we have to have a way of evaluating the performances of the teachers and evaluating how the students are doing, but we need to de-emphasize the standardized testing to reduce teaching to the test. So yes, I share some of your concerns. I think we as a state should welcome the input of the Bill and Melinda Gates Foundation and other non-governmental organizations, but we should also equally, at least, welcome the participation of our teachers' unions, of our teachers, of the average people. So if I'm elected in the assembly, I'll be hearing from the voices of average people, not just listening to billionaires. So thanks for bringing up that concern, Donald. And go ahead, folks.
All right, we have a question from Steve Valenti. Steve, where are you? There you are.
I'm here.
There you are, great. Welcome.
I posed a question that New York State is doing fantastic in lowering their numbers right now of COVID deaths, where many states are not, and may soon meet the 14-day criteria before their second step. What do you think the second step should be as far as reopening New York?
Sure. Well, before I answer this, I'd just like to ask if George or Lisa, if you would like to respond to that question before I give you my point of view.
Yes, thank you. I think from a perspective of, the nurses and what we're seeing in the hospitals, we need testing, and not just for the underserved, which thank God they are getting out there. They're just starting, but we have to get a testing capacity for everybody, because the biggest concern is we have staff who could be positive. Anybody could be a vector, and a vector is somebody who's positive but is completely asymptomatic and could expose somebody else. Until we can identify and track and treat, I think we have to be very, very cautious on how we're going to proceed. And I am very thankful with what the governor has done. Personally, I think he's really demonstrated phenomenal leadership. And as a nurse myself, I'm really thankful because this is really, this has been bad. We've seen how New York City has been affected. We see some hot spots that are popping up in Schenectady County, nursing homes. So I would just like to say, I know people are very concerned economically, and what the economic outfall is going to be. I'm very concerned too, for nurses and families and it just it's a whole. But I think we have to be very, 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 very cautious because this is gonna, we're getting into warmer weather. And again, maybe the Dr. Jolie can speak on this. I'm not a doctor. The concern is that we're going to get into flu season, and again, the numbers are coming down, but we're still seeing a lot of positive, and there's so many who haven't been tested. We don't know who is positive.
Yeah, I wanted to sort of, Joe in his initial remarks addressed this the recommendations that the governor is going by. And I just want to bring them back to everybody's attention because I think this is something each of us need to know about. So they're talking about basically a 14-day, 2-week decline in the number of hospitalizations and virus-related deaths. And they've actually specified a rate of new hospitalizations below 2 per 100,000. This is wonky technical stuff, but if we don't make use of criteria like this, then it becomes impossible for the guy, our town leaders, our other leaders in the state, our schools. It makes it impossible for people to make good decisions unless they have those criteria to go by. So the first thing is the frequency of infections. The second thing that the governor has specified is a healthcare capacity, so that if there's an uptick in the number of new infections, we have the capacity to respond to that. So they're talking about making sure that the hospitals have cleared out enough so that there's 30% open beds. That's in the governor's recommendations. 30% of ICU beds should be available when we really consider opening up and getting rid of the really tight closures. The third thing is what Lisa just referred to, is the critical testing, because some sampling testing has been done in New York State. They're estimating that 15% of the population has been exposed to this virus. That means that there was, and only a very small, a tenth of that was identified as active cases. That means that there are lots of people walking around carrying this virus. To me, that is very scary as an older adult and as a healthcare professional. If we don't have the testing to show who's active, who's carrying the virus, that's the nose swab, and who's been exposed, that's the serological test. If we don't have those, then making decisions about opening up becomes a complete crapshoot. And the fourth thing that is also Lisa referred to was the capacity to follow contacts. Because if you can identify who's actively carrying virus, then you got to go out and you got to talk to where have you been in this last 5 days? Who did you have supper with? Whose house were you at? What stores did you go to? And you got to alert those people that and those are the next tier of people that you test.
Okay. Dr. Jolie, could we ask, we have a couple of people who want to ask you a question.
Sure.
Christine Nichols. Christine, I'm sorry you had to wait so long. Could you?
Oh, no worries. Hi, everyone. Hi, Joe. Great to see you. For those of you who don't know me, my name is Christine Nichols. I'm from Saratoga Progressive Action and WHO Helping Others Onward, which is a nonprofit focusing on domestic violence, rape support, and reform. As we have seen, domestic violence is on a steady, drastic, and to be honest, scary rise. This is not just a societal or legal issue, but at its core, a healthcare issue. As much as COVID needs our focus, I'm concerned about the long-lasting impacts on our communities, our mental health, and our basic fabrics of life. I listened to Cuomo, whom I think has handled this crisis very well. But when he spoke to domestic violence as being on the rise, he spoke of it as bad, but not death. And I had to take issue because I believe death is the final symptom, if you will, of domestic violence.
Yes.
So I guess my two questions would be, one, to Joe Seaman and to hopefully all of our future representatives. How do we address this? How do we handle this future pandemic when more people than ever are stuck at home with their abusers? And when this constant stress is leading to more abuse than we've ever seen without resources or grants that are needed, when our shelters aren't being prioritized. So I'd love to hear your thoughts on that, Joe. And also for the doctor and the nurse on the call, thank you, first of all, so much for your insight. I know firsthand how much we need you on the front lines, both for COVID and also as the first line of defense against domestic violence and rape. So how can we best support the healthcare community through community support or legislation? And what can we do to best enable you to support you in this fight? Now more than ever, you are one of the only community supports that an abuse victim may have and may have access to. I know a recent proposal that was discussed was a method to mark a urine specimen to seek private counsel, in addition to mandatory alone triage time. This all may have become a bit moot during this crisis as individuals are being seen alone, but would either of you have any thoughts or additional proposals that could assist in identification, notification, or handling of these cases, especially during this pandemic while we see it being on the rise?
And can I just supplement what Christine has said? The epidemic is a double whammy for domestic violence and for child abuse. It's people are stuck home alone. There's social isolation. There are none of the things that help people adjust their behavior, manage their anger. And there's a lot of things to be angry about right now. And so the risk for domestic violence has drastically gone up. I was just listening tonight, though, that reporting on child abuse has declined.
Mm-hmm.
And that's because, of course, who are the mandated reporters are the schools and medical offices, and nobody's going into the medical offices, and nobody's going into and the schools are not picking up things. So that I am really worried that there's this under the surface. This problem is not going to go away because there's a crisis. And I'm afraid it's going to be boiling under the surface. And it makes me very, very worried, both for domestic violence and for child abuse. Excuse me, Joe.
Sure. So thanks for bringing up this important subject. And one of the things that I'd like to do when I'm elected in the Assembly is to listen to the voices of nonprofit organizations, such as the organization that you're involved with, Christine, and hear what you have to say. We have to listen to the people who've been involved, who experienced this, and we need to find a way to deal with the problem of domestic violence, especially in these unusual situations. We've done a lot. We've done a lot about child abuse. We passed the Child Victims Act, which is something that I support expanding and giving child victims more of an opportunity to seek justice for crimes against them. So I think we need to do everything we can to protect people from domestic violence. We need to do a lot more education. We need to change the culture. We need to change the culture specifically of males, of men, to see that domestic violence is not perpetrated. So I'd like to hear from the input of nonprofit organizations. Those are the people I'll be listening to people in the community. When I'm elected, I won't be listening to big money special interests, but I'll be listening to nonprofits and community groups. And so while I don't have all the answers, I'd like to hear from our community what the answers are.
Thanks, Joe, and thank you, Doctor.
I would just I would like to add, Christine, that also, as nurses, we are aware of, the potential for, and we do know what's happening, the increase of domestic abuse. And the hospitals are very much aware. They have put out, additional awareness amongst the medical staff. Those that are working in the emergency room, are, when they're screening patients who are coming in, there is a lot of information provided. Additionally, NISNA, State Nurses Association, is working with SPAN. I don't know if you're familiar with SPAN, statewide peer assistance for nurses, but it's not just for nurses, it's for a lot of folks. They're also putting out a lot of material and assistance for mental health, for, really reaching out to other public. So, as nurses, we also are very aware, and we're monitoring as well, because we want, everybody to be safe. So I do want you to know that.
Thank you, Lisa. I appreciate that. I know how important you guys are on the front lines at the battle on that. So I just wanted to reach out on that.
Yeah, and I just want to add mental health. During this pandemic, we see a lot of folks who come in, who are additionally, again, compromised. So we've been really reaching out and doing these town hall meetings with nurses who are actually providers of mental health, and a forum to try to see what are solutions that we can do collectively to help these. So do know that's a priority. Underinsured, very specific group of folks.
Okay, we have a question from Harvey. Harvey, could we have you ask your question? Harvey, are you there? I've unmuted you. Okay, let's go on to Heidi. Heidi, I'm going to unmute you. Heidi Siegfried.
Wait a minute.
I see you. Could you ask?
You're on, Heidi.
Yeah, but I have to unmute. Oh, I am unmuted. Am I?
I unmuted you. The queen
okay.
has unmuted you.
Oh, hi. Well, yeah, I just put my standard question in the chat, but I am concerned about what's happening I'm interested to hear that facilities in Schenectady are having all these deaths, and we run a long-term care ombuds program. So we're really concerned about the fact, it's interesting that we don't allow for-profit hospitals, but it's actually hedge funds and venture capitalists that are buying up nursing homes and de-staffing them, and we have no staffing ratios for nursing homes. So I had made that comment. So maybe you'll want to get on the aging committee, or anyway, I had put my standard question, which is, what 3 committees do you want to be on and why?
Sure.
This is assuming, I always assume anybody I support should get elected.
Okay, presuming I get elected, yes. So the health committee, certainly, the environmental committee, because one of the critical issues that's related to our health is the crisis of climate change, and it's also related to our economics, because we can base our economic recovery. Remember, we're going to have a huge financial crisis following this health crisis, and we can base our economic recovery in green jobs, which I can talk more about. It's probably more the subject of another town hall, and we'll be having other town halls on different subjects. So the health committee, the environmental committee, and the education committee, it's very critical that we see that how our schools are funded is done fairly, and there's a lot of unfairness, inequity in how our school funding is working right now. And again, these are all issues that intersect. People need good jobs, good education, good health care. And it's all about a future for our children, for their children, So those are the committees I'd like to be on. And thanks, Heidi, for bringing up the subject of staffing and staffing at nursing homes. Particular problem, as some of people might know, I've joined the picket lines outside nursing homes here in upstate New York, supporting nurses and other staff who are given too many patients to care for in our nursing homes, and too few staff to do that. And tremendous problems there. And the staff at nursing homes are underpaid. And yes, the nursing homes are owned by for-profit corporate entities. And maybe we should question whether that itself is right. Maybe just as hospitals shouldn't be run by for-profit corporations, maybe nursing homes also should be thought of as a public good, as a public service, and not as a corporate profit center. So thanks for bringing that up. And those are the committees I'd like to be on, but I welcome anyone's suggestions of other committees, other issues. And again, this town hall is primarily about healthcare and COVID-19, but we will be talking about education. We will be talking about climate change, about green jobs. We'll be talking about these other issues related as they are. We'll be talking about fair taxation so that the billionaires pay their fair share and the rest of us aren't overtaxed. They're all related to the crisis we're facing now, but we'll be talking in more detail about those issues in future town halls.
Okay, is Harvey there? Harvey, you had a question, and I'm going to give you another chance. Are you there? Are you gone? I don't know. Josh Mitchell. I see your hand. I'm trying to unmute you, but I'm not having success. There. There.
Yeah,
Josh?
sorry. I'm doing kind of a hybrid thing between the computer and the phone because my computer doesn't have a microphone, but I want to be able to see you guys and not have my phone like in my hand for like an hour and a half. So, I did put my question in the chat box, but I will talk about it. I absolutely appreciate Christine Nichols bringing up the topic of domestic violence, and Joe brought up the topic of bail reform. And I support bail reform, but it's not perfect, and has had some issues. And one of those issues, and I personally heard this multiple times, is that domestic violence victims are often not able to have their abusers removed from their proximity, and that was an issue before bail reform, but it's exacerbated it unintentionally. I heard, and I'm not going to, obviously, I'm not going to give names or anything, but someone who was abused by their landlord, the landlord was taken away by the police and just dropped off, like not brought to the station, dropped off not that far away, and he came back. So that is my concern. I don't know if Christine or Joe wants to address that question.
I can hear you now. You want?
So let me just briefly address my thoughts on that. I think that as a separate matter from bail, a separate matter from money, that we need to do everything we can to protect domestic violence victims. We need to keep their abusers away from them. And it's separate from bail because if it's a matter of bail, then people who commit these crimes, if they have enough money, they'll be able to get out and commit the crimes again. So we need to have objective criteria, standards in terms of when people are dangerous, what dangers they present to the community, and take the actions to prevent victims, to protect the community. But that's a separate issue from bail, because bail is simply a matter of, if you have the money, you pay and you get out. If you don't have the money, you stay in jail. So we need to separate finances from the issues of safety and protecting our community.
Thank you, Joe.
Thank you.
I would still like to know if Christine has any thoughts.
Sure. So to piggyback off of that, I almost completely agree with Joe. To be honest, in my own personal case, my abuser was back in 2017, back before most of the bail reform laws were really enacted. And he happened to be an attorney who was very well off. He wasn't even set bail. I think originally he was set bail and then it was dropped completely. However, he was charged with multiple felonies and misdemeanors, but because of his position and again, finances, it didn't really matter. I know I have many clients who are in a less well-off situation than their abusers are, and some of them have been set bail, some haven't. It seems like it was always kind of haphazard. And to be honest, even as on the other side of it, it seemed to be more discriminatory and prejudicial in the beginning of it and less due to the evidence. So even from my side of it, I think we have to be more for abusers' rights as far as following through with orders of protection and allowing the emergency orders to be enacted right off the bat, regardless of bail. And regardless of financial constraints. So I think that should be where we're focused on that issue. But I really appreciate your question because I have seen similar circumstances to what you discussed as well. So I do think we need to focus on the orders of protection and less on the bail.
Thank you very much, Christine.
Yes, thank you, Josh.
I think one problem as a retired attorney, I just like to say that I think one of the biggest problems with bail and setting bail and not letting people off without bail, the judicial discretion can be exercised by a judge, of course, who has prejudices built in. And that's why the bail statute needs to remove a lot of judicial discretion. I mean, in your case, your abuser being a good old buddy gets let off. And in other cases, a Black male may appear to be too scary to let out on bail. Just want to posit that. I have a question from Harvey, who had to leave the call. So he put his question in the chat box. So Joe, I'm going to ask Harvey's question, okay?
All right, please.
All right. Harvey says, I would guess that virtually everyone on this call knows what the issues are and what needs to be done. The question is, how specifically do we get it done? What needs to be done is to get Joe elected. Right. What are the money-raising efforts and how do we increase that to get the word out? What are the needs of the campaign specifically, and how can we, the attendees of this meeting, help? I didn't write this question.
Okay, I thought you would.
Question.
That sounds like a question you would have written, Susan, but thanks,
Yes.
Harvey, for that.
Harvey's good.
So we're having a town hall talking about what we need to do once I get elected, what the New York State Legislature, New York government needs to do. But yes, I certainly need to get elected. And following this town hall, we're also going to have other virtual events. We're going to have virtual house parties and fundraisers. So I would ask anyone, if you want to support my campaign, or if you don't want to support my campaign, but you have some issues that you want to address. Either way, please go to my website, which is joeseeman.com. That's JOESEEMAN.com. And there's a donate button, and you can contact us with your ideas again. So we're certainly in a battle to get elected, and we need funds, we need volunteers, but we're also trying to, while we're in the midst of this campaign, we're also trying to serve people. So this town hall is about educating people, about giving people a chance to have their voices heard. And once I'm elected, I think people will have more of a opportunity to have their voice heard, and heard right in the legislature. So we're going to keep on fighting to win this. One of the things that we're doing right now, our campaign has volunteers who are making phone calls, and we're doing this largely as a matter of mutual support. We're calling people and seeing what assistance we can provide them. There are a lot of people having problems due to this crisis. We run to some people who had problems obtaining their unemployment benefits, and we've tried to help them. So we're going to be trying to find a balance between running to win, which means raising funds and reaching out to people, but also continuing to serve. I've been an organizer and an advocate for justice and for the interests of the average people. So have many of the people on my team, Susan, and many of the others involved. So we're trying to win this campaign, and we're also trying to keep fighting for what's right before I get elected, and of course more so once I get elected, when I can fight from the inside. So thanks, Harvey, for bringing that up, and thanks to everyone who supported my campaign. And please just go to joeseaman.com, JOESEEMAN.com, if you want to support my campaign. And again, it's not just for people to support my campaign. It's also an opportunity for you to share your concerns. Again, I'm running this campaign based upon the issues that I know about, the knowledge that I have, and the experience that I have. But I'm always open to hearing from people who have other ideas. And also want to let you know, we invited my opponent, the incumbent, and we'll be inviting her to dialogue with us in the future. So thanks everyone for supporting my campaign, and thanks everyone also for giving us your input. That's really important.
Okay, I think it's almost 8:15, and I think we've gone through most every question. And I want to thank everyone for being involved here, for your help, and for your good questions. And we'll see you again soon, because we're going to do this again.
Yes, we will.
I hope you'll all come back.
So stay tuned and share with your friends. If you share the website, joeseaman.com, you'll see the announcements of our future town halls, of our future activities. So folks, stay tuned, share with your friends, and looking forward to hearing more from you.
Joe, I just want to say you have the support of the nurses. We're here.
Thank you.
That means a lot.
And you have our support too.
My
We know
support
that,
as
and we
well.
appreciate
Thank you, Joe.
Okay.
Thank you. Thank you.
Bye, everyone.
For moderating.
Thanks, Susan, and all our team for doing your part to run this. Thanks everybody for putting up with our technical difficulties. I know I've had problems with the technical aspects here. So thanks everybody for being patient with us.
Thank you. Goodbye.
See you next time.
Thanks, Joe.
Thank you. And I think for anybody still on, one more thank you to the nurses. Today is National Nurses Day. So let's make sure we all thank the nurses, not just with our words, but with our actions. And that's what this campaign is going to be about, and what I hope to do in the assembly. So thanks especially to the nurses on National Nurses Day.